How much radiation is in a nuclear stress test? If you're considering a nuclear stress test and wondering about the radiation involved, you're right to be curious. Let's break down the details to help you understand what you're looking at. A nuclear stress test is a diagnostic tool that uses a small amount of radioactive material to see how blood flows to your heart during rest and activity. Here's the key part. This test involves radiation. When you undergo a nuclear stress test, you're given a radioactive tracer through enrollment 4. This tracer is what allows the camera to take images of your heart. The amount of radiation from this tracer is significant, but it's important to understand the context. The radiation exposure from a nuclear stress test is often compared to other common medical procedures. For instance, it's equivalent to about 400 chest X-rays. To put this into perspective, the effective radiation dose from a nuclear stress test averages around 10 to 27 millisieverts, MSV. To give you a better idea, here are some specific numbers. A typical nuclear stress test can have an effective dose of about 10 MSV, which is similar to the radiation from 500 posterior-anterior chest radiographs. In some cases, this dose can be as high as 27 MSV. It's also worth noting that the radiation from the test is not immediate and does not last forever. The tracers used in the test decay over time, and your body eliminates them. For example, the kidneys help get rid of some of these tracers, so staying well hydrated is important after the test. While the radiation exposure is a consideration, it's crucial to remember that nuclear stress tests are generally well tolerated and can provide critical information about heart health. However, for patients with low risk of heart issues and no symptoms, other tests like stress electrocardiograms or stress echocardiograms might be recommended instead due to lower radiation exposure and cost. In summary, a nuclear stress test involves a significant amount of radiation, equivalent to hundreds of chest X-rays, but it is a valuable diagnostic tool when used appropriately. Always discuss the risks and benefits with your healthcare provider to make an informed decision.